Talking about rabies. So, some background information about rabies is that it falls under the family Rhabdivoridae, and the genus for it is Lyssavirus, which, fun fact about that is that Lyssa means rage in Latin, which makes sense that rabies falls under this because every time you hear about an animal having rabies, you hear how aggressive they become. So it makes sense that it falls under a category that deals with rage. There are 10 viruses that fall under the rabies subgroup. Here, I only list the two most common ones, and they both happen to deal with bats. So you have the European bat virus, which there are two different types, and then you have the Australian bat virus. Rabies is a viral zoonotic disease, and then it is also considered a neurotropic virus, which means it affects the nervous tissue. So, rabies causes progressive and fatal inflammation of the spinal cord and the brain. Once you get bitten by a rabies infected animal, you need to seek treatment because the moment symptoms start, there is no treatment that you can get that will save you. Because once symptoms start, it's going to have the same end result, which ends in death. So, with that being said, there is an estimated amount of about 60,000 human deaths per year in over 150 countries. 95% of those deaths happen in places like Africa and Asia, where they don't have much prevention there because it's so expensive. So a lot of people don't get it. And then half those cases happen to children that are under the age of 15. And then rabies is caused by 99% of the time by dogs. And then a new upcoming health threat is in bats, which they are starting to get rabies, and that threat is in Australia and Western Europe. So in this picture that I have here, again, you have about 60,000 deaths per year, and you can see that in the US, you have between 1 to 3 deaths, and while in India, you have between 25 and 30,000 deaths. The reason why we have so low is because we prevent our dogs. And we highly tell people that you need to prevent your animals. And so that's why we have such low rates of deaths. While in India, since it's so expensive to get the preventions, they just don't do it. And so you have a lot of rabid animals over there. So you have a lot of animals that are biting people and causing death. So, the rabies virus is a bullet-shaped virion with a single-stranded ribonucleic acid nucleocapsid core and lipoprotein envelope. So you can see that picture that I have to the left. You can see it has an envelope membrane, and then you can see in the center of it has the ribonucleoprotein. The picture that I have to the right, that is actually an affected neuron, and where the arrow is pointing, that's the rabies virus that is in the cytoplasm. So it causes around 60,000 deaths worldwide. So even though there's an animal vaccination for dogs, they are still rated as the most common animal to get rabies in many countries. Yes, as I said before, dogs cause around 90% of human exposure to rabies, and then they cause 99% of human rabies deaths worldwide. And then most deaths occur in countries that have inadequate health resources and limited access to preventative treatment. Underdeveloped countries also have few diagnostic facilities and almost no rabies surveillance. So in those underdeveloped countries, we really don't know how many rabies infected animals they have because there's no way to truly know that number if nobody's keeping track. So some history about rabies is that the first written record of rabies causing death in dogs and humans is found in Babylon in the 2300s BC. So in the 1st century AD, a Roman scholar, Celsus, said that rabies was transmitted by saliva, which is correct. But what's wrong was that he said for a cure, you were supposed to hold your victim down in water. And if they ended up surprisingly not drowning by that, they died of rabies later. So really, it was a lose-lose situation. And then, so the first real treatment of rabies happened in the 1880s when this man named Louis Pasteur created the first rabies vaccine. He ended up also creating the post-exposure prophylactic vaccine. And today, we still use those because it ended up working and still use them today, and it has helped solve so many cases of rabies. Okay, in this picture that I have, it shows the amount of human deaths from rabies. So you can see that in underdeveloped countries that they have more deaths of rabies than what we have over here, because again, they just don't have the money to buy the prevention or to buy the treatment. So you can't really do anything about that, and that they don't really have the right medical facilities to deal with this. So, yeah. And so, in the US, there are 5 antigenetic variants of rabies strands. So you can see that in the East Coast, we kind of have like the raccoon strain, and then towards the north, they have the skunk. Down mid-south, they have the other skunk strain. And then, there's kind of variation around. Okay, and then for transmission, we have rabies is transmitted through saliva. And it's transmitted, so the only way you can really get it is if the animal has bitten or scratched you and their saliva has come into that wound. Only 15% of animal bites are actually transmitted to humans. So, depending on where you were bitten, depends on how fast the rabies virus will travel to the brain. So, like, if you're bitten in the arm compared to the leg, it's obviously gonna travel faster from the arm than it is from the leg because it's closer to the brain. So that means the incubation period that it has is going to be shorter than when it is in the leg. So recently it has been announced that bats are the major source of human rabies death. And I think that has been confirmed in like the last year or two. And then there's a theory out there that says that human-to-human bites can also transmit rabies, but has never been confirmed. Then it can also be transmitted by a transplant, but that is very rare. Yeah. And then a species that is considered a low risk is a possum. They don't really get rabies because they have such a low body temperature that the rabies virus just doesn't survive there. And then in this picture that I have, you can obviously see the raccoon biting the dog in the leg. And so you see how the virus gets through the bite wound, through the saliva, and then it goes towards the muscle, and then it goes towards the spinal cord, and then travels up to the brain. So there are 2 types of rabies that we can obtain. There's the first one, which is the furious rabies, and then there's a paralytic rabies. The furious rabies is the most aggressive one. So it's a type of rabies that deals with hyperactivity, excitable behavior, hydrophobia, hallucinations, and sometimes aerophobia. Since it's so aggressive, death will occur in a few days after bitten due to cardiorespiratory arrest. For the paralytic rabies, this type of rabies only occurs in about 20% of human cases. This type of rabies is less dramatic than the furious rabies, obviously, and it also takes longer to start showing symptoms. So, this type of rabies causes paralysis, and you will probably end up in a coma, and then death will occur. Uh, this rabies, this type of rabies is often misdiagnosed, which doesn't help for reporting the disease. So, we don't really get an accurate number. So, 20% is kind of just an estimated guess because since it's so misdiagnosed, we don't really know the true number that happen, like true number of humans that can get this. So for etiology, rabies is a neurotropic virus that invades the immune surveillance. The virus first enters the peripheral nerves, and then amplification occurs until bare nucleocapsids spill into the myoneural junction and enter the motor and second sensory axons. And then the rabies flow through the axons into the spinal ganglion and is multiplied there. This causes the pain or paresthesia at the site of inoculum. They then spread quickly to the central nervous system, and that leads them into the salivary glands. And that it is important to note that this action is a neurotoxin rather than direct damage. Okay. For pathogenesis, so the first thing that happens is absorption. So the virus is absorbed through the membrane. And then endocytosis occurs, and then fusion, and then it releases the viral RNA, and then transcription occurs. And then the next step is glycoprotein synthesis, and then it transports that back to the membrane, and it fuses to the membrane, and that is the pathogenesis. So, some signs and symptoms that rabies has is it causes fever, headaches, vomiting, anxiety, hallucinations, depression, agitation, anorexia, chills, and insomnia. In the picture, you can see that the dog has overly saliva, like it has so much saliva coming out of its mouth. That's another one of the symptoms because when the virus is traveling through the spinal cord, yes, it goes through the brain, but it also goes to your salivary glands. So it causes a lot of production of saliva. So this picture shows the progressive symptoms. So in the beginning, you'll have pain, tingling, itching, flu-like symptoms. So those are like the lower level symptoms. And then the next one, you'll get fever, you'll get confusion, agitation. This is when you start to kind of get like the neurological problems. And then next you have even further symptoms, which is seizures and spasms. And then next you'll have the various organs in the body that are affected, which is kind of one of the worst ones before death. And so there are 5 stages of the rabies virus. So the first stage is incubation, which is the period between where you are bit and before you get your symptoms. This is the period where you can get treated. And if you get treated, you will get cured from rabies. But if you wait till the second stage, which is prodrome, that's the stage where you first start seeing symptoms. And at this point, you can get a treatment, but it's not going to help at all. It's going to end in death. So you got to get the treatment in the incubation stage to be able to get cured. So the third stage is acute neurological period, which is the time when it really starts affecting your brain. So, and then the fourth stage, you'll go into a coma, and then fifth is death. So for the sequela, as I explained earlier, that once a person starts showing symptoms, it's most likely going to lead to death. If you get the treatment before you start showing symptoms, then you can be cured, but that's only if you get it before you start showing symptoms. There was one case study that I did read where a woman got bit and she started showing early symptoms. She got the treatment either way, and by the end she was all fine. But as a couple of days passed, she started having neurological problems where she had a hard time balancing and her hand-eye coordination was completely off. This is one of those rare cases where, and I mean like really, really rare, that you got cured when you started showing symptoms, because that doesn't happen often. So, some guidelines for if you are bitten, what you should do. So, if you are bitten by an animal that you suspect has rabies, gently irrigate the wound site with water to help decrease the risk of bacterial infection. Once you have done that, you need to see a doctor. If you think you have rabies, you need to get a series of shots to prevent the infection from spreading, and this is before you have symptoms. So don't wait after you get bit to go see a doctor, because depending on when you got bit depends on how fast these symptoms can occur. If you get bit closer to the brain, then you probably only have like a day or two before you start showing symptoms, rather than if you got bit like in the leg. It's going to take a little longer than a day or two before you start showing symptoms. So you need to go sooner rather than later to see a doctor to get treatment so you can get cured. So for treatment, once you get bitten by a rabies-infected animal, you will be giving something called post-exposure prophylaxis. Once an individual shows symptoms, they are brought into intensive cardiopulmonary supportive care, because this is the only treatment available to people who start showing symptoms. And this will not help cure you, it will just help make you comfortable until the time comes where you will probably pass. So getting the rabies vaccine once you start showing symptoms, again, is ineffective. You can't really do anything about it at that point. You already waited too long, and it's too late to do anything. Some doctors give sedation so it can provide comfort and manage the spasms that you get. And then, yeah, no matter what treatment is done, it always ends in death. And then you have some doctors use nimodipine, which is used for cerebral vascular spasms and can cause severe hypotension. So this is not used much because it causes that, but I mean, it could help sometimes. So the rabies shot, it's actually the rabies vaccine that Pasteur invented. So it's also called a fast-acting shot, or the rabies immune globulin. So this shot helps prevent the rabies from infecting you, and its injection is given in the arm. Once bitten, this shot is going to be given near the wound where the animal either bit you or scratched you. You will receive 4 injections of this shot over a period of 14 days. This injection is given to help your body to be able to identify and fight off the virus. So there are 2 different prophylaxis shots. So there's a pre-exposure prophylaxis and there's a post-exposure prophylaxis. The pre-exposure one is considered a booster. So this vaccine is given to individuals who are at a continuous or frequent risk of rabies and who undergo periodic rabies antibody testing. So if you know you are going to an area where you are going to spend a lot of time with animals that are probably infected with rabies, you might want to think about getting this pre-exposure prophylaxis shot. This shot is given 3 times, and each shot costs around $1,500. And so the post-exposure prophylaxis, which is also called PEP, is given once an individual has been bitten. So this is given during that incubation time. So when taking the prophylaxis, it may cause local pain, arrhythmia, headache, nausea, and abdominal pain. So this whole chart that I made is kind of saying that when you should get the pre-exposure prophylaxis. So like for rare, most of the US population doesn't get it because they're not around rabid animals. So the infrequent ones kind of go with veterinarians and just students or wildlife workers who are around animals, but they're not really rabid animals, but you can get like a handful of them every once in a while. So you would just get a primary course with no booster. So you would just get the treatment basically if you end up getting bit by one, so you don't need a booster. So for the frequent category, this goes to people who work in labs, who work with the rabid animals, and then animal control or wildlife workers or other veterinarian staff that work a lot with rabid animals. So for these people, you need the primary course and then a booster for every 2 years. Yeah. And then for the continuous category, it's basically for people who are constantly around animals that have the rabies disease. And for them, you need the booster. And then you also probably need to get the rabies vaccine with it. And that you need to get testing for rabies every 6 months. So this picture that I have is kind of explaining what I said earlier. So you need to get the post-exposure prophylaxis during that incubation period, because once the symptoms start, there's no point in getting it because it won't do anything but maybe slow the virus down, but it's not going to stop it from infecting you. So once you get bitten by the animal, you need to receive 4 doses of the rabies vaccine, and then rabies immunoglobulin, which same thing. So the post-exposure prophylaxis is given to a patient on the day or exposure and on the days 3, 7, and 14 is when you need to get it. So on those days after you have gotten bitten, those are the days you need to get this shot, which this shot is not cheap, and so that's why a lot of people try it, or that's why a lot of people also die from rabies, is because any type of treatment or vaccination is not, it's expensive. So that's why, like in developing countries, that's why a lot of people deaths, because they can't pay for this treatment. They can't pay for the post-exposure prophylaxis because it's so expensive. Yeah. So the post-exposure prophylaxis vaccine is made of a dose of human rabies immunoglobulin, and it's also made up of the rabies vaccine. So this vaccine is given around the wound site, but not where the vaccine was given. So, I'm sorry, the human rabies immunoglobulin is given around the wound site, but the rabies vaccine is given in a different place. So the rabies vaccine is given in the arm, but make sure that is not where the wound site is. So for people who already have the vaccine, so the rabies vaccine, and have previously gotten the PEP vaccination, should only get one rabies vaccination when they get bitten by a rabid animal. So this vaccine is given to someone who has already been bitten by a rabies-infected animal and is used to prevent the virus from entering the central nervous system, which could lead to death, which I said before. If the individual who was not previously vaccinated against rabies, they need to be given human rabies immunoglobulin. In the US, the CDC recommends rabies post-exposure prophylaxis only with intramuscular cell cultured vaccines. So in this category, it kind of breaks down like in three categories. Depending on the amount of contact you had with an animal, that depends on how much vaccination you get or what vaccination you should get. So like for category 1, if you are just touching an animal and its saliva touches your skin, but there's no exposure to it like hitting a wound or anything, you don't need any treatment. You are completely fine. For category 2, this is when the animal is like nibbling on your skin and you have like minor scratches and you have a little bit of exposure. At this point, you still probably need to see a doctor because you would need the rabies vaccination. Yeah, and then just local treatment of the wound. For category 3, this is the worst one, when the animal most likely bites or scratch you and the saliva definitely gets into those wounds. With this, you need immediate vaccination and you need to administer rabies immunoglobulin and you need treatment of the wound. So, yeah. With this chart that I have, so it's like a flow chart. So it's kind of give you categories. So if you have, so like for animal species, if you have a dog, you're gonna go where a dog, and you're gonna like go either it's escaped or captured or quarantined. Let's say it's escaped, and if you know whether it has rabies or not, it's gonna tell you like if it has rabies, you're gonna get the vaccination, and then the HR, the human rabies immune globulin with that. So it kind of like, it's like a flow chart. So depending on which animal you were in contact with and like how you were in contact with it, it tells you what vaccines to get at that time. So yeah, it's helpful. So for testing and diagnosis, so there's not really a good way to test for rabies. There are some, but there's not really like a great way for it. So for humans, unless the person has hydrophobia or aerophobia, then it's really hard to diagnose. A person can confirm rabies by using diagnostic techniques that detect whole viruses, nucleic acid, and viral tissues or viral antigens. You can either run these diagnostic techniques alive or dead. That's one way for humans. But for animals, you have to test the brain to determine if it has rabies or not. So to do this, though, if you're testing the brain, you kind of have to kill the animal. So if you don't know whether it has rabies or not, the only way you're gonna find out is to kill it. So it's kind of gonna suck if you kill an animal who doesn't have rabies and check their brain and find out they're not affected. But these tests are done once the animal is collected and euthanized, and is done 24 to 72 hours after the animal has died. So yeah, also for animals, there's a thought to have If it has been bitten by a rabid animal, they need to be kept in isolation in a vet's office for up to 10 days. And if they start showing symptoms, then they have rabies. But if they don't, then we assume they're fine. So they'll be let back to their owner or wherever they came from. So for prevention, like I said earlier, in the 19th century, Pasteur created the rabies vaccine, which successfully prevented rabies, and we still use this today. It's amazing. So you need to consider getting the rabies vaccine, especially if you are traveling to a country that you know has a lot of rabies infected animals, or that rabies is pretty common, or is also a place where remote care is hard to come by. So that's like your developing countries. You also need to keep bats out of your home and don't approach wild animals. A wild animal with rabies will seem unafraid of people, and that's not normal for a wild animal because they should act scared of people and not friendly. So, prevention of rabies in people. So the first thing is leave all wildlife alone. Even though they look all cute and cuddly, don't go touching it because you don't know what that animal is doing. Like, you don't know if it's going to be aggressive. You don't know if it has rabies. And then you can contract rabies if you go trying to go pet it or something. And then it could bite you, and next thing you know, you have rabies. The second thing is know the risk. Contact with infected bats is the leading cause of rabies death in the US, followed by exposure to rabid dogs while traveling internationally. The third step is to wash animal bites or scratches immediately with soap and water to prevent like infection or spreading faster. The fourth thing is if you are bitten, scratched, or unsure, talk to your doctor about whether you need the post-exposure prophylaxis or not. Rabies is 100% available through the right medical care. So don't wait until you have symptoms. Talk to your doctor and get treatment right away. Number 5 is vaccinate your pets to protect them and your family. Because again, this is 100% preventable if you just vaccinate your animals and be aware of your surroundings. You will be fine. So, prevention of rabies in pets. So, the first thing you need to do is visit your veterinarian with your pet to receive the rabies vaccinations and keep them up to date with them. If they are not up to date with them and they get them irregularly, the vaccination won't work the same. So you need to be up to date with them and get them every year or get them up to date. So number 2 is maintain control of your pet by keeping cats and ferrets indoors and keeping dogs under direct supervision. 3 is spay or neuter your pets to keep the amount of unwanted pets away from your pet because you don't know if they have been vaccinated or not. 4, call animal control to remove all stray animals in your neighborhood since these animals may be unvaccinated or ill, and you don't want your pets or your family or friends getting around those animals if you are uncertain whether they are unvaccinated or ill. So rather be safe than sorry. So there's 5 tips that I have on here on preventing dog bites. The first one is don't disturb or frighten the dog, particularly when the dog is eating or tied up, because that's when it's vulnerable, and if it's feeling threatened, it's probably going to try to bite you. I mean, this just goes for any dog, no matter what, if it's infected with rabies or what. Just try to be patient with it and don't frighten it. 2 is keep away from the dog when they are angered or scared. 3, don't move if the dog approaches you when it's not on a leash. Yes, that's pretty self-explanatory. 4, if you approach the dog, then approach it slowly and quietly, because again, you don't want to threaten or feel like the dog is threatened. Because if they feel like they're threatened, they're gonna try to attack you. So calm and slowly walk to the dog, act friendly. Another thing that I learned is that if you put your hand out in front of it and let them smell you, it can also help with that, keep them calm, and it gets them familiar with your scent, and so it makes you look friendly. And number 5 is, if the dog bites you, you need to act quick by washing the wound with soap and water and then take yourself to the doctor's. Which, yeah. So, controlling rabies in the animal populations. So, mass control and mandatory vaccination of domestic dogs and cats are effective in controlling rabies in the US. However, developing nations have found cost to be a barrier, which I said before. We in the US are very demanding on having our animals vaccinated, while of course in developing countries the price for prevention and then treatment is so expensive, where they just can't do it. And then, as I said in other slides before, if you do happen to get bit or an animal gets bit, it's so hard to find a care unit because they're so scarce. Another thing is live viral vaccines are placed in bait and placed out in the woods in the US and in Europe. This is used to control foxes, raccoons, and coyotes. So this gives them their vaccines so they can basically just control them not getting rabies, which I think is a very smart idea, and I did not know they were doing this until I read this article about it. So the World Health Organization has a thing that they're trying to do by 2030. They're gonna have 0 human deaths by then. So they are gonna try to get a bunch of other animals vaccinated so we can get this accomplished. And so we have a World's Rabies Day, which is on September 28th. So normally on those days, especially I know at the vet's office that I worked at, on that day we give discounts on rabies vaccinations, so that's one way to help with this. So keep your animals vaccinated. And maybe this could possibly happen in 10 years. We can have 0 human deaths in 2030. And then this is my works cited list. And